Laboratory testing is one of the most essential parts in diagnosing a patient. It determines a patient's overall health and well being. That is why medical laboratory scientists are one of the most important staff in a medical health establishment.
Medical laboratory science provides clues that are key in the diagnosis and treatment of disease or injury, and laboratory professionals are the detectives of the healthcare world. They provide clues that are key in the diagnosis and treatment of disease or injury and assist in the maintenance of healthy lifestyles.
The patient experienced some signs and symptoms of an unknown illness. The day after that, he went to the hospital to have a checkup. After the patient arrived at the hospital, the nurse in charge for outpatients records his vital signs such as blood pressure, temperature, and pulse rate. This procedure may be done with a physician, but most hospitals let the nurses acquire these vital signs so the process will be quick and efficient. After both parties introduce themselves, the physician may start asking some important questions that will be relevant to the following procedures. Questions such as:
What are the symptoms you have experienced?
I cannot sleep well for how many nights because of some muscle pains that I've experienced in my body, particularly in my wrist, ankles, and abdomen. My face is swollen. I don't like to go to work. I don't have strength to get up because of my muscle pains. I lost my appetite and I feel like I'm going to vomit every minute if I'm going to eat. I need to be well ASAP because I have competition to join.
What was the last time you did that might be connected to what you are experiencing right now?
If you are talking about my muscle pains on some parts of my body, yes, it is quite painful. I don't have good sleep at night because of it.
What medications or vitamins do you take? Do you or your family members have any medical history?
I have been quite healthy for the past years since I was an athlete. But I didn't exercise that much for a year since me being an athlete is just a hobby and it's pandemic and my family members are quite healthy.
After arriving at the laboratory, medical laboratory scientist or medical technologist will require a specific sample for specific tests. In the case of our patient, samples such as urine, feces, and blood are mostly required. In this situation, we will be focusing on the clinical chemistry testing for creatinine in blood. Creatinine, produced as a byproduct of muscle contraction, is fairly constant in the blood and is freely filtered by the glomerulus of the kidney, useful in the evaluation of kidney function and in the diagnosis and treatment of renal diseases. After confirming the identification of the patient, we can start preparing the apparatus for the venipuncture. Phlebotomy apparatus such as evacuated tube, syringe, needle, tourniquet, cotton, and micropore are the commonly used materials in this procedure. Different tubes have different colors that coincide with their additive. In creatinine test, a green top tube which has an additive of lithium heparin will be used as the preferred one, since it separates the serum from the blood. Let the patient sit comfortably and position him with the chosen arm for collection extended from a straight line from shoulder to wrist and apply the tourniquet approximately 3 inches above the site of collection. After that, palpate the antecubital area and search for a vein. Preferred sites for collection are antecubital fossa or median cubital vein. Clean the collection site with alcohol-wetted cotton with a rational direction from inside to outside. While waiting for it to dry, prepare the syringe and needle. Reapply the tourniquet, then start to transfix on the area where the target vein is. Make sure that the bevel of the needle is facing upward, as it will cause further complications such as hemolysis of the blood and possible hematoma. Remove the tourniquet and gently apply cotton on the collection site and pull out the needle. Secure the cotton with a micropore. Be quick, gentle, and careful during this part of the venipuncture. Label the tube by writing the name of the phlebotomist, the patient's name, age, Gender, DOC, TOC, and what test the blood will be used for. Allow the blood to clot for 5 to 10 minutes before centrifuging for 10 minutes at 10,000 RPM. After centrifuging, separate the serum from the blood cells in a different clean tube and label it. After the venipuncture, the sample can be then delivered to its corresponding test. The creatinine test uses a machine called spectrophotometer.
Spectrophotometry is a standard and inexpensive technique to measure light absorption or the amount of chemicals in a solution. The Jeffries method is followed in this process. The method explores the oxidation of p-methyl amino sulfate in the presence of copper sulfate and creatinine, which yields an intense violet-colored species with maximum absorbance at 530 nanometer. In the standard sample tube, 100 microliter of a standard solution is added. In the unknown sample, 100 microliter of the serum is also added. Since we are focusing on the creatinine test, let's set it in the creatinine test. Make sure that the number values in the machine are correct, such as the wavelength and temperature. The machine will ask for you to aspirate it first with water blank. Dunk the tube inside the water blank container and press the aspirating button. Don't remove the water blank while it is still aspirating. After aspirating with the water blank, proceed to aspirate the reagent blank. There will be two absorbance results and is categorized as absorbance 1 and absorbance 2. Absorbance 1 will take 30 seconds for the result to show and 2 minutes for the absorbance 2. Write down the result for the preceding calculation. The aspiration procedure will be the same for the standard and unknown sample. The machine will provide a direct result for the absorbance and concentration, but in the case where the machine will not provide result, we need to calculate it manually. This is where the absorbance 1 and absorbance 2 of each sample will be used. After the laboratory testing, the result should be checked before releasing in order to identify if there are analytical and pre-analytical errors, such as the machine giving abnormally high or low result. Then, the result can be released and interpretation of the physician can be executed.
The results are then released to the physician in charge of the patient so that she can then interpret it. The patient has a high result in creatinine level. The result is quite predicted because of the patient's lifestyle. Intense exercise for days can cause sudden increase in blood creatinine level and symptoms that they experience, but it needed a thorough laboratory test for confirmation. Creatinine that comes from your blood is a serum creatinine, and it can be measured by administering a routine blood test. When kidney function becomes impaired, less creatinine is able to be cleared, which results in a higher level of creatinine in the blood. While this test does not directly tell you how well the kidney is functioning, it can be followed over time for changing. Healthcare providers can use this creatinine blood test along with the factors like age, sex, race, and etc. to calculate glomerular filtration rate or the GFR, which is vital in diagnosing kidney failure or chronic kidney disease.